Well, good evening, everybody. Welcome to the leadership webinars of the PDA, which we call Bridging the Information Gap. I'm Ward Blackwell, Executive Director, and I'm happy to be your host for the evening. Before we get fully underway, we always have a little housekeeping we have to do to make sure everything flows smoothly. As the lady announcer just said, all of the participants are in listen-only mode. That means your mic will not be open and you will not be able to turn on your camera. You will, however, be able to ask questions of our panelists tonight by typing them into the question box. The control panel for our GoToMeeting usually appears on the right-hand side of your screen, and you look where it says questions, click the little triangle next to that. It opens up a box, type in your question. I will read the questions at the end of the hour and direct them to the appropriate panelists. You can type them in at any time during the webinar, but we won't actually answer them to the last 10 or 15 minutes. With that, we've got the housekeeping out of the way, now the commercial. As always, these webinars are brought to you in part by our PDA Member Advantage program, which is run by Pennsylvania Enterprise Resource Corporation, a subsidiary of PDA. Tonight, we really want to call out three of our partners in particular. Best Card for credit card processing. They are our only platinum level partner and terrific, unbelievable savings if you use your member discounts. Also, Payroll Plus. They are one of our bronze level sponsors and a great payroll solution for small business, which is why we endorse them. And finally, one of our newest partners in the program, the Dentist Supply Company, now owned by Henry Schein, but it started by California Dental Association, beginning as a subsidiary program, and it still has the same great savings, even with the new ownership, which is why we endorse it, because it's a great deal for our members. Now we've got that out of the way, I'd like to introduce tonight's panel. We have a lot of people and a lot to report on. Our president, Dr. Limberakis, the co-chair of Leadership Academy, along with Dr. Friedman, Seth Walbridge, Dr. Bruce Cary, who is the facilities lead for the Mom and PA program, now part of the PDA Foundation, Dr. Jim Mancini from our Workforce Task Force, Dr. Marian Wolford from our Environmental Issues Advocacy Group, Dr. Darleen Oleski, chair of our Government Relations Committee, and Dr. Craig McKenzie, who represents us on the ADA Council on Membership. That is tonight's all-star panel. And to get things kicked off, as always, we will let our president have his prerogative. And Dr. Limberakis, please tell us what you got for us.
Thank you, Ward, and good evening, everyone. I'd like to begin my report talking about the ADA's National Sign-Up Day, which took place on Tuesday, March 2nd at the University of Pittsburgh School of Dental Medicine, and on Wednesday, March 19th, which took place at Temple University's Kornberg School of Dentistry and the University of Pennsylvania School of Dental Medicine. This is when ADA reaches out to all the D4s across the country to encourage them to continue their ASDA memberships into ADA memberships, which is free for the first 18 months after graduation. PDA members present at Pitt were Doctors Allison King, Juan Cary Hale, Craig McKenzie, and Anitha Potluri. At Temple were Doctors Renee Fennell and Saul Miller, and at Penn were Doctors Greg McGann, Lauren Yap, Dave Tukoski, and Cary Limberakis. The D4s were informed of all the benefits and rewards of ADA membership. On a personal note, at the social event that evening, I connected students with ADA officers and trustees of each of the states in which they were doing residencies or graduate studies in the coming year. I was told, gee, Dr. Limberakis, you know so many people across the country. And I responded, well, that's what ADA is all about, helping our members thrive and connecting them with fellow members who can help them. And recently, the ADA announced its 10 under 10 winners. And for the third straight year in a row, we had PDA winners. This year, they were Dr. Craig McKenzie. Wave your hand, Craig. Way to go. And Dr. Lauren Yap. Congratulations. They followed Dr. Rupali Kulkarni last year and Dr. Sanya Setia the year before. The PDA is very fortunate to have these future leaders in our association. In addition, the PDA announced its 10 under 10 winners. They are Doctors Ingrid Carvo, Kelsey Dagenhart, Jyoti Danji, Rajveer Jutla, Allison King, Aaron Mursky, Selena Wen, Ryan Rother, and Jignesh Verdani, and Jessica Yee. Congratulations to all, and we look forward to your leading PDA in the future. And continuing on the awards theme, I'd like to congratulate our 2025 PDA Annual Awards recipients. The PDA Public Service Award recipient is Dr. Miriam R. Robbins. Dr. Robbins has spent a significant portion of her career working to improve the oral health of the underserved special needs population. Currently, Dr. Robbins is a director of the Care Center for Persons with Disabilities at Penn Dental Medicine, where she treats patients with disabilities and trains future dentists to provide expert oral care to patients who live with physical, development, and intellectual disabilities. PDA commends Dr. Robbins for her efforts to provide dental care for the underserved. The PDA Recognition Award goes to Dr. Hiran Helen Jian. Dr. Jian is an assistant professor at the Department of Orthodontics at Penn Dental Medicine. She has published over 25 articles in peer-reviewed journals on her research interests in bone remodeling, clear aligner treatment, and growth modifications in skeletal class 3 malocclusion. PDA is pleased to recognize Dr. Jian's clinical and research achievements and her dedication as an educator. The PDA Distinguished Service Award is presented to Dr. Cynthia L. Schuler. Dr. Schuler started her dental career as a hygienist before earning her DMD degree at Pitt Dental Medicine in 1984. She has shared her time and talents with her community in Washington, PA, and her dental family at the local, state, and national level. The Dental Society of Western Pennsylvania describes Cindy as a passionate, dedicated, and knowledgeable leader. The Dental Society and PDA are grateful to Dr. Schuler for her years of tireless service to organized dentistry. Again, our heartfelt congratulations to all of our PDA Annual Awards recipients. Next on the agenda is the upcoming Pennsylvania Dental Meeting, the PDM, on April 25 and 26, in just a couple of weeks at the Desmond Hotel in Malvern, close to King of Prussia. The theme of our meeting is Be Well. The festivities actually begin the night before, Thursday evening, when President, or soon-to-be ex-President-elect Ted Rockwell, and I host a reception for all attendees, followed by a fun axe-throwing event. Hope you can join us. The meeting begins in earnest on Friday morning with our keynote address by Emmy Award-winning TV host, food writer, and editor, Keilani Palmisano, known for her TV show, Check Please, Philly, and her articles in Food and Wine, the Philadelphia Inquirer, and USA Today. Following the keynote address, the Board of Trustees will convene its day-long meeting, the last of my tenure as PDA president. A healthy living panel discussion on healthy eating, stress management, and ergonomics, and a course about AI in our future as dentists will comprise the morning CE session, along with chair yoga interspersing the courses sponsored by the New Dentist Committee. Friday's afternoon CE courses will address key financial considerations for new dentists, as well as another financial wellness course for established dentists. ADA Wellness Ambassador Kathy Hung will provide an interactive presentation which will help one evaluate areas in one's life that might need attention. Friday evening will kick off with a welcome reception, open to all, to mix and mingle, and then at 7 p.m. we will have the members' celebration and awards dinner honoring those making an impact on our profession. Saturday's agenda includes more morning and afternoon CE courses, a meeting of the Council of Trustee Regions, the annual business meeting and town hall, a student and resident poster contest, and concluding with a reception hosted by the American College of Dentists, the International College of Dentists, and the Pierre Fauchard Academy for its fellows and guests. Last on my agenda, yay, is our Family Vacation CE Conference on August 14, 15, and 16 at the magnificent Hyatt Regency Chesapeake Bay Golf Resort, Spa, and Marina in Cambridge, Maryland on the Eastern Shore. 3 morning CE courses will be offered, and then you have the afternoons and evenings to enjoy with your families the many amenities of this resort, as well as the excellent nearby restaurants. I hear crab is in Maryland. Make sure you make your reservations early, as the conference attendance has doubled in size the last 2 years we've had it, as the word has gotten out how great a time it is. And on a note of personal privilege, I want to express my appreciation to you, the members of the PDA, for the honor and privilege it has been for me to serve as your president this year. I never could have predicted when I graduated dental school in 1978 that I would be retiring from this noble profession as the president of the Pennsylvania Dental Association. Thank you very much for this honor. Back to you, Ward.
Thank you very much, Dr. Limberakis, and I'm sure it's going to be a great celebration to send you off with a high note at the end of your term at the PDM. Everybody's hopefully going to be there. All of you join us tonight. We also hopefully you'll join us on these other events. And one thing you will get to celebrate while you're at the PDM will be the graduating class of PDA's next Leadership Academy. And here to talk with us about that is one of the co-chairs of that academy, along with Dr. Jay Friedman. It's Dr. Seth Walbridge. And Dr. Walbridge, tell us what's going on with the academy.
All right, cool. Thanks, Ward. So just to be clear, Jay pretty much handled most of this stuff. So I just want to give Jay a shout out. He handled a lot of the stuff for the Leadership Academy this year. So I just want to be clear and recognize him for that. So I always like to end positive, and I just want to share with everyone. I just want to be very transparent about what went on and my thoughts on it. So I call this slide "What was meh." What could we improve on? So I think everyone can agree that if you have meetings in person, they're a little bit more involved. There's a little bit more interaction, engagement for an in-person meeting. That being said, the virtual meetings were very good as well. But we had a little bit of an issue, as we seem to have every year, about the availability of our presenters. So we might have to change the time of certain meetings when they're on the schedule for a certain time, and it messes with people's schedules. So the availability of our presenters can be kind of a hiccup sometimes. And then I call this the ability of the presenters to use technology. So in no way is this the fault of our PDA team. This is the presenters that come. For some reason, we always have an issue with technology, or they are not able to access their slides, or they're not able to play a video, that sort of thing. So these are all things that we can improve on, and I have some thoughts on how we can do that, but I can get into that another time. I can go to the next slide. But that being said, it's great, and the metrics that I personally use to kind of rate how good the Leadership Academy program is in general is we have leaders coming up all the time through here, and in my opinion, they wouldn't even be involved any further had they not come through the Leadership Academy. So all of the people that attend the Leadership Academy, very engaged. They're very kind and friendly. When there's any kind of disagreement, it's very cordial, it's very professional. They came to our meeting with all the ADA president-elect candidates, and we got really good feedback on that. So where are they now? This is kind of, like I said before, how I would rate how well the Leadership Academy did, or how is it as a program. Past graduates and our current students even, they're with us in important leadership positions, and they're on our delegation even this year. So we have people on the Leadership Academy that are on our delegation this year. So that's just a big push to just continue to find them places to land, which is on the next slide. So what's next? I call this slide "What's next?" So something that we need to do just a little bit better is we need to adapt our topics yearly. So, and I write on here, AI better be one of them. So I've taken a deep dive into AI, and I think we need to get more involved with it. I think we can all agree on that. But we need to adapt our topics, to suit the times. We need to continue to engage with them as leaders. And we had a pediatric specialist this year, and she was wonderful. But we need to figure out how we can engage more specialists, because they're members of our organization as well. In person versus virtual, I think we can all agree we'd like more in-person events. Can't always happen, and we have people from all across the state, so that can't, it's not always perfect for everybody. And then Jay and I had discussed about involving current and seasoned leaders with running of the Leadership Academy. It's good to get new ideas, new faces. We get our seasoned, experienced dentists with our new ideas of our younger dentists. So we need to keep leaders kind of cycling through, helping to run the Leadership Academy. And I think it can be great. And then just continue to find places for the Leadership Academy graduates to land. So we need to keep finding them leadership positions. And, I think that metric in itself is why this program is successful, because that's what we're doing. We're finding new leaders to come up through the ranks. Look no further than our PA delegation to the ADA. I think we have by far the youngest delegation, and I think we have the best delegation. So that's all I have.
Thank you very much, Dr. Walbridge. And yeah, that is a terrific program, and we have so many graduates from it that are up and coming and filling great positions in the PDA. Really would encourage anyone who might have an interest or know someone who would to apply. Another really great program that we want to bring your attention to upcoming is the Mom and PA Dental Mission. And Dr. Bruce Terry is going to fill us in a little bit more about this year's event. Dr. Terry.
Thank you very much, Ward. I'm very happy to be here tonight and give you guys a little bit of a update on what's going on. First of all, for those that don't know, you saw on the previous page that the Mom and Pa organization, Pennsylvania Mission of Mercy, has merged with the PDA Foundation. That was last year. And that's given us a new collaboration and joint resources with the PDA to make the dental mission even better. And so thank you, PDA, for your help and assistance with our mission going forward. So for those that don't know, and I think probably most of the people I see on the screen tonight, and probably a lot of our guests, have all participated in a previous MOM, maybe all of them. And I thank you very much, and letting you know, June 6th and 7th at the Wilkes-Barre Arena, the Mohegan Arena there will be our next missions, the same location we had in 2019. And we had one of our largest events there of record. We opened up registration on April the 1st. To this current date, I think I saw from Ron Heyer, we have something close to 360 volunteers currently, and that's with 8 days of the sign up open. So we do need up to 1,000 volunteers to fill out all the positions. We always find that we're in desperate need of dentists, dental specialists, so that's general dentists, pedodontists, oral surgeons, endodontists, and even if you are not one of those categories that do work in a row, you can come as an orthodontist. We can put you to work. You can do medical triage or dental triage, and you can perform other services, and you can help and be part of the solution of access to care in Pennsylvania. So we would love to have you come, even if your specialty is not a hands-on specialty as we know it. We are still raising money, and so we're still looking for sources of donations. We're always looking to fund our programs going forward. So if you happen to be connected with somebody that may have not known that they could be donating to such a worthy endeavor, let us know. make yourself heard to Ward, to me, to Gary Davis, Bernie Dishler, Ron Heyer. We would love to be able to talk to people and try to bring them on as partners. So please let us know. Again, it is June 6th and 7th this year. And so tell your friends that could come up, tell your staff that could come up, come and have a great time. It is almost as fun as PDM. And and you will have a rich and rewarding experience while you're there. So there's just one more thing you can do is just go there and register if you haven't already done it. A few other things that you can see on this page is we're looking for anybody that can help with lab services up in that area. We're looking for EFTAs, dental hygienists as well, and dental assistants. So if you're coming, volunteer your staff, bring them up. It's just such a great experience. We're moving forward. The locals up there are planning a nice reception Friday night, as usual. And with the community chairs, the local chairs up there of Dr. Abad and Dr. Grossman, this is just going to be a really, really good event this year. So once again, I'm being the perennial cheerleader for Mom and Pa, and I want to see all of your smiling faces up there. But Ward and everybody else, thank you very much for time tonight. I appreciate it.
Terrific. Thank you very much, Dr. Terry. And as someone who's volunteered at this event for several years, I have to say it's so rewarding. And I do hope everybody listening tonight will avail themselves of this terrific opportunity to give back. With that, we're transitioning now to a report from our Dental Workforce Task Force and Dr. Jim Mancini, who's been very active promoting dental professions. Dr. Mancini, want to give us the details?
Thank you very much, Ward. Hi, everybody. Just wanted to give a brief description of what we've been working on. We all know what the situation is with dental auxiliaries. Anybody that's ever looked for a hygienist or an assistant knows exactly what I'm talking about. They're not hard. They're very hard to find, and we've lost a lot of people in our profession. COVID was probably one of the biggest drivers. So we need to rebuild that. So one of the ideas that I had was to meet with, you see their PACAC, which is the school counselors in Pennsylvania, figuring that those people, have access to many students, and if we can convince them that dentistry is a great career, then they would pass that along. And I can tell you that has been very successful. I've gone to several of these meetings. Myself, Dr. Limberakis, Dr. Himmelberger, we've gone to these to talk to the counselors, and they greatly appreciate us telling them about our profession. Our profession has kind of fallen off their radar. If you go to one of these meetings for the counselors, you're going to see all kinds of groups there. You'll see, not only are there colleges there, but there are other professions there. The Flight Attendants Association, the steel workers, the truck drivers, the Carpenters Union, Cosmetology, the Welders Association, places like Home Depot and Walmart. They actually come to these meetings and have exhibits for the counselors to see, to pass along to their students. There was a guy sitting across from us with a flight simulator to encourage the counselors to recommend that their students look into becoming a pilot. And again, not necessarily being college track, but just as the profession. And our profession needs to be at these things. We need to point out to them what a great career dentistry is, and we've kind of fallen behind. And so that's why I started going to this. It's been, again, a great experience. The counselors come to us and talk to us. They take our handouts. On this slide, you can see some of the handouts that we have, and they take our handouts to take back to their schools to talk to their students. We have also gone to, if you go to the next slide, actually started going to some large student events. As you see there, it's called the PA HOSA Conference. The HOSA group is high school kids who want to get into healthcare. And Dr. Limberakis and Dr. Himmelberger went to the Health Occupations Student Association meeting. There was 2,000 kids, 2,000 plus kids there. So, again, talking about dentistry, we need to promote our profession because if we don't do it, no one's going to do it for us. That's the whole purpose of meeting with, both the counselors as well as the students. So my plea is that every county, every school district in this state has some kind of a career focused event every year. It's actually part of the education, the Department of Education in Pennsylvania. It's actually in their rules that they want them to do that. So sometimes it's just one school district, sometimes 3 or 4 of them get together. But if you see that, any member, please sign up to go there, to talk about our profession. And if you can't sign up or you can't go, please call us at PDA. We'll send somebody. We can send you the handouts. We can get you the information so that you can talk about dentistry as a career, and it would greatly benefit all of us, every one of us. So, just a real quick plea to please keep your eyes open. Every one of us pays school taxes. So, that's your school taxes basically at work. You can help our profession by going to these events. That's pretty much all I have. Just wanted to update. Anybody that has any questions or anything, I would be happy to answer them. But thank you very much, Ward. Thank you for the time.
Of course, Dr. Mancini, and I thank you, because this is predominantly a volunteer-driven effort, as you can obviously see, and it's very important. I would say, just my own experience, I probably hear more from members about workforce issues these days than anything else. And this is one clear example of what PDA is trying to do to address this pressing problem for our members. So very much appreciate all your hard work. Another issue that's maybe not quite as high profile these days, but that is nonetheless vexing some members, relates to those lead shields and the change in recommendations from the ADA. Dr. Marian Wolford on PDA's Environmental Issues Advisory Group has been working on that for us and has an update. Dr. Wolford.
Okay, thanks, Ward, and hello, everyone. I'm going to jump right into the first slide. And currently, Michelle, if we could go to the next slide. Great. And so currently, our radiation safety practices in our office are based on these 2 documents. On the left is the ADA recommendations for patient selection, and that was done in 2012, so a while ago. And on the right is the NCRP report 177. That came out in 2019. It can be purchased from the federal government for about $80, and that includes all the recommendations and explanations for those recommendations. Next slide. Okay, so last week I spoke with Erica Benavides, and she is the vice president of the American Board of Oral Maxillofacial Radiology, and she teaches at the University School of Michigan, School of Dentistry at the University of Michigan. And she sent me her latest PowerPoint on the new patient shielding recommendations. So if we could go to the next slide. And the articles that Ward was just talking about was in 2023. An article was published in the JADA. Dr. Benavides was the first author, and this was an ad hoc committee that was to draft evidence-based recommendations and clinical guidance regarding shielding. And based on the absence of heritable effects in humans and the negligible dose to the gonads and fetus, the committee recommended discontinuation of shielding during all radiographic imaging procedures. On the right, also by Dr. Benavides, that article reviewed 95 different papers, guidance documents, and regulations. And basically, it's a summary of the regulatory guidance and best practices. There is a QR code on both of those, and so if you'd like to read those articles in their entirety, that would be available. Okay, next slide. So what does it mean? Well, there's definitely a paradigm shift in radiation protection. The current recommendations that were published in that ADA paper is that all shielding should be discontinued as a routine practice. But that shift is going to take a bit of time to educate the patients, because for so long they have become accustomed to shielding. So it is going to take some education. And you can go to the next slide. From that paper, these are the reasons, is that they found that there was negligible scatter radiation. It does not reduce internal scatter. no heritable effects, and in fact, the shields may obscure anatomy. And you can go to the next slide. One of the sticking points is the thyroid shielding, and what they found was that thyroid dose of at least 50-fold lower than the lowest doses associated with thyroid cancer risk from their research. And so for those reasons, they felt that the thyroid collar is also unnecessary. What they found was that the digital receptors and rectangular collimators are more effective in reducing the dose to the thyroid gland. And next slide. But there are special considerations for pediatric patients, and that's because children are more susceptible due to the sensitivity of their organs, as well as their longer lifespan. The radiographs for children should be justified clinically, and that all of our X-ray equipment should be configured to optimize performance specific to age and size of the patient. So no one size fits all. And next slide. And all of the recommendations from the group, Dr. Benavides' group, were in alignment with each of these organizations. Now, of note, the second organization on the list is the NCRP, and that's the one that DEP in our state, I think, is still following, because recommendation number 19 still says that a thyroid collar shall be used when possible. So what are we going to do in PA? In the next slide. Michigan has started a patient education program, really, or campaign, and these are the two flyers that they are starting to put in the School of Medicine, School of Dentistry, to get patients comfortable with no shielding. And what we're hoping is soon we can have the green light from DEP here to be able to follow the same direction, because we'd like to start a patient education campaign statewide and then also implement a lead apron collection program so that the dental offices can dispose safely of those lead aprons. So next week, April 30th, I have a meeting at DEP. Dr. Benavides graciously allowed me to use either all or part of her presentation for this talk, and also to pass on to the DEP. And hopefully, even though the update is not out yet, we feel certain in the next few months it will be, and maybe we can get permission from the DEP to move forward with elimination of lead shielding. And that's all I have. And then, the last slide, I do have some flyers that the American Academy of Oral and Maxillofacial Radiologists have put out, and that also has a QR code, and that would be a great advertisement or information for your patients to also in Pennsylvania get comfortable with elimination of the lead shielding.
Thank you very much, Dr. Wolford. That's a lot of information in a short period of time, and terrific that you have the bandwidth and the connections to bring it all to bear. So hopefully we get the answer we need from DEP very soon.
Yep, and I'll keep it.
Go ahead.
I said I'll keep you posted.
Awesome. Thank you so much. Since we're kind of looking at a regulatory issue, it makes a good transition now to talk about legislative issues, and that involves our Chair of Governmental Relations, Dr. Darleen Oleski. Dr. Oleski.
Thank you, Ward. Lots to talk about tonight. We're going to start right in on our legislative update. Governor's budget proposal includes a $15 million monies to support healthcare workforce initiatives, while $10 million is intended to provide educational loan repayment to more behavioral health care providers. There's some flexibility in how the $5 million earmarked for the needs of rural Pennsylvanians could be spent. PDA is part of a stakeholder community educating lawmakers about the need to attract more dentists and dental hygienists and assistants to rural areas in the Commonwealth. We're also tracking any developments at the state level as Medicaid funding issues continue to shake out at a federal level. There's a few bills right now impacting dentistry, and they have been introduced. House Bill 544, which is our credentialing reform bill. This requires that practitioners and insurers to use the CAQH system, requires timely notice of applicants when the application is incomplete, limits the credentialing period for 45 days, streamlines the process for practitioners practicing in multiple locations. And this is also introduced by Representative Steve Metzger and assigned to the House Insurance Committee. We're also looking at, we don't have a bill number on this, but the dental loss ratio reporting. We're still working with Representative Mullins, who's my representative on this, to reintroduce this bill this session, which would require dental insurance to report their dental loss ratios to Pennsylvania Insurance Department. Representative Mullins, and this is kind of the sticking point, would like a consensus from the stakeholder community so that all would remain neutral on this bill as the bill would move out of committee. We had another meeting with him recently to try to finalize the language on this bill. Network leasing, we're getting a House bill. We don't have that number yet, but we're working on that. PDA lobbyists are working with Senate leaders to identify the right legislator to introduce the network leasing bill. It will require prior notification from dental insurers before they lease networks and allow dentists to opt in or opt out of that new network. House Bill 583 is the restoration of dental Medicaid coverage for adults. This will require that the Commonwealth restore dental benefits provided to adults prior to the cuts that were made in 2011. The services covered prior to 2011 and those currently covered in the Medicaid program are the minimum required. The Commonwealth would choose to cover additional services. That's what we're looking at. We're looking at additional services. This was introduced by Representative Gina Cary and assigned to the House Health Committee, which is soliciting feedback from the stakeholder community with the intent of moving on a bill this spring. PDA is, of course, sending a letter of support. As you can see, all of these representatives really want a consensus before this bill is even moved, period. We don't want to get stuck at the next level. House Bill 157 is the Rural Health Care Grant Program, which incentivizes healthcare providers, including dentists and dental hygienists, to practice in rural areas in the Commonwealth. Facilities in rural areas may be able to apply for grants to pay for providers' educational debt. Providers may meet certain criteria to be eligible for that loan repayment. And this was introduced by Representative Kathy Rapp and reported out of the House Health Committee in February. And then we have Senate Bill 81, and the House bill is to be announced, Dentist and Dental Hygienist Licensing Compact. Representative Frank Ferry reintroduced legislation for the Commonwealth to enter into join the licensing compact endorsed by the American Association of Dental Boards. Representative Kyle Mullins will soon reintroduce legislation for the Commonwealth to join the licensing compact proposed by the Council of State Governments. So we have the two. Both bills are assigned to the House Professional Licensure Committee. The Department of State is working to resolve issues that arise due to the Commonwealth's laws on clearances, specifically having to do with FBI checks for out-of-state practitioners applying for a compact privilege. The Government Relations Committee is meeting next week to talk over a whole bunch of things. Most notably are negotiations with our credentialing bill, several proposed policies relating to the dental workforce, particularly as it relates to the use of dental assistants. And plans are underway to utilize a public relations firm to launch a campaign to better educate our media, policymakers, and the public about challenges facing dentistry, particularly with attracting dentists and the dental team members to practices in the Commonwealth. Staff sent a request to area PR firms to submit proposals outlining the services they could provide for PDA, including things like letters to the editor, opinion pieces in the paper, social media platforms to elevate our message about given workforce problems, third-party payer issues, Medicaid. So we'll be using grant money given to us from the ADA's SPA grant program to pay for this PR campaign, which we think will get underway sometime in May. Lastly, we will be giving PDA's Kate Thompson Outstanding Legislator Award to Representative Greg Scott at the annual meeting in Malvern later this month. Representative Scott introduced and championed our virtual credit card legislation through the legislature and to the governor's desk last session. It will be a great opportunity for us to acknowledge and say thank you to Representative Scott for supporting our #1 dental insurance reform issue last session. I also want to make note of the fact that a number of our PDA leadership will be meeting with our legislators in Harrisburg on May 12th and 13th, one at a dinner meeting and one at a luncheon to discuss all of our issues facing dentistry in the Commonwealth. Next slide. We had a very successful lobby day in Washington, D.C. 15 members and about 25 dental students attended. Some members to Seth and Jay's credit were from the PDA Leadership Academy, and they reported that the conference was a wonderful supplement to the leadership skills that they acquired while being a part of that academy. We spent 3 days in DC learning about the issues, supporting our legislative friends at fundraising events, and making a trek to Capitol Hill for meetings. We visited the legislators and staff of almost every Pennsylvania congressional delegation and our 2 senators, Senator Fetterman and Senator McCormick. We talked to them about the READY Act, which would defer interest on student loans for dentists who enter residency programs after dental school. We had talked about Doc Access, which would close the federal loophole that exempt ERISA self-funded plans from state laws and prohibit insurers from capping services they do not cover in their dental plans. And we also discussed authorizing and funding a study by NIH on the safety and efficacy of community water fluoridation. So that was a lot, but we did a lot. So as you can see from those pictures, we had a lot of our members there, and it was a very good time and very important to do. And lastly, I'm going to make a sacrificial plug for our PADPAC and AdPAC. All of these events that we attend and all of the work that's done through GRC, through our lobbyists, is done with PAC funds. So if you could please contribute to the PAC, it really makes a difference. The Pennsylvania PAC is PADPAC, and that would help contributing to us speaking to members of our legislature in Harrisburg. AdPAC, of course, is speaking to our members on the national level, and we can't do one without the other. Many of them feed from one to the other. You need one first or one second. So I thank you all for any and all contributions that you can do, and thank you so much for reaching out to your legislators whenever you can, especially keep an eye out for those action alerts from the PDA and ADA. Thank you, guys.
Thank you very much, Dr. Oleski. That was a lot to do, but as always, I have such faith in you to not only be able to lead our GR efforts so well, but to convey all this complicated information very succinctly. Before we get into our last report of the night, just a quick reminder that you can type your questions for any of our panelists into the question box in about 5-6 minutes. Once we finish with the report, we'll start taking those questions and direct them to the panelists, but you can type them in at any time, and now would be a good time. With that, now I'd like to introduce a newcomer to the webinar, Dr. Craig McKenzie. He is our representative to the ADA Council and Membership, and I know that's a busy council at all times. So Dr. McKenzie, what do you have for us?
Great, yeah, thanks so much, Ward. I'm pleased to provide a pretty high-level overview of the Council on Membership and some updates from our meeting that we held last February in Chicago. So first things first, I want to talk a little bit about Salesforce Fontiva since it consumed a lot of our meeting. This is really not something that everyday members are probably thinking about, but it is a powerful association software that has the potential to shape the member experience. So the transition from Aptify to Salesforce Fontiva, Aptify was our previous membership management software. Salesforce is our new membership management software. It's been challenging. There's been some tech challenges along the way, leading to some states, thankfully not Pennsylvania, having issues tracking membership data, including renewals and non-renewals. Again, not an issue for Pennsylvania because we have not transitioned at the state level. However, I just want to keep on members' radar that they might receive some odd emails from the ADA. I received one personally telling me that I didn't renew my membership for this year, and I know I did. So any membership issues, feel free to reach out to the PDA. Marian and her team can give you a quick verification and can help navigate any challenges, again, due to this like loss of information between transitions and software. It is absolutely on the ADA's radar to resolve these issues with Salesforce Fontiva, and they're working very hard to resolve these technological issues. These two pieces of software have a really robust system behind them. They're needed to help provide a high level of customization as well as member engagement as part of the new membership and engagement pilot model. So there's a lot of opportunity here to engage our members on a more personal and individualized level than the ADA has done previously. So on our next slide, we'll be talking about the membership and engagement pilot model. This was developed by ADA staff previously, and I'm pleased to share that the council will now be tasked with reviewing and providing feedback as the membership model is rolled out through this 3-year pilot period. So limited data with how successful the pilot is limited, again, due to those like the tech issues with the Salesforce Fontiva implementation. However, I'm pleased to share the 5 pilot states that have been involved in the new membership pilot model have been receiving significant support from ADA staff and the ADA team, and then there will be additional states that join in 2026. Because the federal services are so unique and don't really belong to a state necessarily, the Council on Membership is encouraging the Board of Trustees to allow the federal services to also join as part of the membership engagement and pilot model for 2026. So again, Council on Membership will play a more active role in the upcoming year as far as monitoring progress, looking at the data coming in from Salesforce, and recommending changes to increase member value as we move through these 3 years as part of the pilot model. For those of you not super familiar with the pilot model, I think the 2 big things are it cuts dues significantly. So as far as the financial barrier to somebody perhaps joining the ADA, that has been reduced significantly. And then the levels of customization have also increased to help members have a membership experience that means a bit more to them. Because perhaps, Cary mentioned that he was getting ready to retire from dentistry, has different member needs than me, say somebody who's a couple years out of school. So the membership engagement and pilot model allows the ADA to adapt to the unique member needs as they move across their career. The next thing that I'd like to talk about, kind of related to changes in the membership structure, are 2 different models that the Council on Membership is exploring. And these are the group membership models that I'll talk about here on the next slide. So the first group membership model that I want to talk about is the group practice membership. And this right now is being discussed by a task force. It's in the early stages of creating group packages for medium and large scale group practices that could be then scaled across the state and local levels. These are not like DSO level large group practices. These are more like dentist owned, maybe 1 or 2 states, large group practices, or like maybe medium sized group practices of 5 to 10 offices. Not those like big gigantic DSO practices necessarily. And then and so in that one, a group practice could then sign up, and then all of their members within the group practice could have some level of ADA membership. The other group membership model that we're exploring, this is a task force that I'm chairing at the Council on Membership. This is the dental school institutional membership. So similar to the group practice membership, we're thinking about dental schools as group practices and faculty members having very unique needs from organized dentistry. So this new initiative would help establish a group membership model for dental school faculty to increase engagement amongst dental school faculty, and then hopefully relay that value down to students. This is very similar to how the American Dental Education Association looks at membership. So I am not necessarily an individual member of ADEA as a faculty member, but rather my institution, the University of Pittsburgh, signs up for membership, and then inherently I become a member. These group membership models will allow us to grow our market share in membership areas that historically have low market share. And again, high market share is vital for the ADA to retain its relevance, as well as retain its ability to advocate for the profession, as well as the patients we serve. On our next slide, I'll talk about membership engagement. So membership engagement, 2 things that we discussed were the ADA social media strategy, and the focus of 2025 is looking at social influence and the impact that the ADA can have on ADA members and potential members through platforms such as Instagram, Facebook, and even TikTok. The ADA is utilizing brand ambassadors as well as brand like listeners, people that listen to issues that come up, especially in these private Facebook groups, report those back to the ADA to find solutions, and then influencers as well, people that will go to our meetings and positively represent the ADA brand on social media. Something else to keep an eye out for is a new initiative from the Council on Membership, a membership ambassador program. And these would be 2 members per state that would help share the brand of the ADA and assist with grassroots recruitment, retention, and representation, again, of the ADA's mission and brand. The next thing I'll discuss is the ARC grant on the next slide. ARC stands for the Acquisition, Retention, and Conversion Program. And this has been a really successful program at the ADA. Don't quote me exactly for the numbers, but something like every dollar that's put into the ARC grant is around $20-ish back to the ADA through membership dues over the life of a member. So this program has been very successful, so much so that this was previously increased to $500,000 due to demand for these grants from state and local components to hold programs, again, promoting recruitment and retention of members. This program is on hold, however, for Q3 and Q4, as the ADA Board of Trustees is meeting at their April meeting to do a comprehensive review of the ADA budget. So Q3 and Q4 grant cycle is on hold until the decision is made from the Board of Trustees about the future of this and other programs. And then last but not least, I want to talk about our collaboration with other councils. I think we're all quickly making the realization at the ADA that there's significant overlap between the work of the different councils. Specifically on membership, and this is on the next slide. Specifically on membership, we're talking about collaboration with the Council on Communications because it's important that we communicate our member value. And then we're also talking about a subcommittee of Council on Membership, Communications, and New Dentist Committee to help eliminate redundancy and promote some synergy between the 3 groups working together towards some common goals. So that concludes my report, and I'll move back to Ward so that we can move into any Q&A.
Thank you very much, Dr. McKenzie. As I said, it's a busy council. Looking at the question box, we don't have a real question. There's a statement just from Dr. Himmelberger not being able to move forward with adopting the ADA recommendations on lead apron shieldings until DEP changes their guidelines. That until that happens, it's technically a violation. Dr. Wolford, did you have any further comment on that?
Well, the lead shielding, we need an answer from DEP, or I'm sorry, the thyroid collar. The lead shielding, we do have an answer from DEP in writing that we do not need to use lead aprons. So I think we can all be comfortable with eliminating the lead aprons at this point. The only, we did not get in writing about the thyroid shield. So I think what has to happen is Dr. Benavides, when I called her, I said I couldn't understand why the papers seem to be in conflict with the NCRP report 177. I said, you must have inside information that to publish that report, that something is coming out. And she said, in fact, it is. Because a lot of the people that were involved with the NCRP report were also involved with some of these recommendations. So she couldn't say exactly when, but we're hoping in the next few months. So once that happens, I think we can move forward. But I will find out on April 30th, whether DEP would, if the recommendation or the update has not come out, will they allow us to move forward to start to educate the patients that no shielding is necessary?
Thank you very much, Dr. Wolford. Appreciate the clarification there and hope that's helpful for everyone in the audience. Don't see any other actual questions. There were some comments which were addressed previously about our award winners, and hopefully everybody is clear on where we had some incorrect information, but also correct at the same time, which is the one to be looking at. We do have a couple more minutes. I think actually Dr. McKenzie had a comment he wanted to share. Dr. McKenzie, I'll just go ahead and let you ask it live.
Oh, mine was in relation to the lead shielding as well, about the balance between, well, what's the ADA and AAOMR's recommendation versus like what the state law and state dental board regulations were. And I think that was addressed in a previous answer.
And it was. Okay. Then Not seeing any more questions. I do have a request from Dr. Cary to make an additional quick statement regarding the Mom and Pop program. So Dr. Terry, the floor is yours. But your mic is not open.
Okay. Can you hear me now?
Yes, sir.
There you go. I apologize for that. So one other comment I neglected to make is that we have flyers available for anybody on this call that might want flyers to distribute to prospective volunteers. And PDA has them, and of course, Mom and Pop leadership like myself and others have them, so you can reach out to us. If you want to print out flyers for volunteers, that could be your staff or even lay people that might want to come and help do auxiliary tasks during the event. And then flyers that you might want to hand out for prospective patients starting in a month or so to let them know that we're having this event up at the Mohegan Arena in Wilkes-Barre, June 6th and 7th. Thank you, Ward.
My pleasure. And just for the audience members, if you look to the right of your screen in the control box and click by where it says handouts, that should reveal 2 links to the flyers that Dr. Terry is referencing. And you can just click on those and download them to your computer or print them out at your leisure. I'm not seeing any other questions having come in yet. We still have 3 more minutes if anybody has another question they wish to ask. Any questions from our panelists for other panelists?
I do for Dr. Wolford. I'd like to know where we dispose of our lead shields.
Well, Dr. Schuler and our group has been talking about putting together a statewide collection program that we can work with safety. We're going to work with to dispose of them properly, but we're waiting on implementing that plan until we know that we have the go-ahead from DEP. So yes, we would like to make a program available so all dentists, maybe 3 points in the state. Dr. Schuler has some preliminary information on that. So.
Thank you.
Sure.
All right. Well, Dr. Wolford, we may need to have you back for the next webinar then, because by that time, hopefully we'll have all these questions a little clarified. I'm not seeing any more new questions, but we are getting close to the bottom of the hour. So we'll go ahead and wrap a couple minutes early, or at least one. I do want to remind everyone that this event was recorded, and copies of the recording can be found on the PDA webinar and video library accessible on our website. Quick little technical thing, you need to log in as a member first to be able to access the entire library. A lot of great content there. I encourage everyone to do that and to share with your colleagues who did not join us tonight the ability to get all the great information that was conveyed by watching the recording. Finally, mention that right after we hopefully will have some more information regarding the DEP situation, we will be having another webinar in 2 months' time on June 2nd. That is a Monday. We hopefully will have everybody joining us again at that point in time. And I can promise you we'll have lots of other great information for you. And if you aren't on summer vacation, you should join us. If you are on vacation, remember that we've recorded. Once again, I'd like to thank our panel tonight. We have a jam-packed evening full of great information. So Drs. Wolford, McKenzie, Oleski, Limberakis, Cary, Walbridge, and Mancini, thank you for your time. To the audience, thank you for joining us, and we'll see you in a couple of months. Happy spring, everyone.